Again, today's topic is stomach flu or gastroenteritis, which is very common in wintertime in Japan. Most of the stomach flu is caused by viral infection. However, some of them are caused by bacterial infection. You are going to have normally, if you're infected, watery, non-bloody diarrhea, no blood in your stool. And also, you are going to have abdominal pain or abdominal cramps, and nausea and vomiting, or both are very common with this illness. And eventually, you're going to have a low-grade fever up to 38 degrees Celsius, and muscle cramps, muscle pain, or headache. Incubation time is normally 1 to 3 days. And the symptom will last normally up to 2 days, but in some cases, especially with norovirus infection, the symptom will last up to 7 to 10 days. I'm going to explain the self-care later, but first of all, I would like to explain when to see a doctor. In the case of adult, the patient is adult. If you are not able to keep liquids, if you are not able to drink some liquids more than 24 hours, you should go to a doctor. Or you've been vomiting more than 2 days, or you are going to vomiting bloody thing, or you are dehydrated, then you should go to the doctor. It is rather simple to determine whether you are dehydrated or not. I'm going to explain you. If you press the fingernail for 5 minutes, the color of fingernail turns into white. You can see it, no? And after releasing it, the color will recover to red one. If it takes more than 2 seconds, you can see it, then you are dehydrated. So you should keep your hand at the height of your heart and press your nail for 5 seconds and release it. And if the color will recover within 2 seconds, you are not dehydrated. But if it takes more than 2 seconds, you are dehydrated. In the case of children, the thing is a little bit different. Children are more liable to be dehydrated. So if your child has a fever of 102 Fahrenheit or more than 39 degrees Celsius or higher, or if they are lethargic or irritable, the mood is going to change when they are seriously ill. So from the point of parent, it is very easy to determine. Or if your children have a lot of discomfort or pain, or bloody diarrhea, or if they are dehydrated, then you should bring your children to a doctor. The method of determining the dehydration is just the same as adults. In the case of the infant or baby, the thing is once again a little bit different because they are much more liable to be dehydrated. So has vomiting lasts more than several hours, not days, and haven't had a wet diarrhea in 6 hours. Or in the case of baby, you can feel a soft spot at the top of your head and has a sunken soft spot. The baby is dehydrated. Or if your baby has a dry mouth or cry without tears, then these are the signs of dehydration, so you should bring your baby immediately to a pediatrician. Lastly, I'm going to explain the self-care. In the case of diarrhea or severe vomiting, you are going to lose large amount of potassium, kalium. So the electrolyte must be collected. In the Japanese market, this electrolyte correcting fluid are available, OS1. It is available in any drugstore store or in pharmacy. So would you please purchase and drink it? In other cases, you should drink it more than 2 liters, 4 bottles of them, so long as you have a sign of dehydration or vomiting, nausea, or dehydration.